Hi, I'm Trista and I'm doing my video on the eye. So this is kind of what I found of the eye, and it gives us all the parts of our eye. So like, we have our lens here and our pupil, the posterior chamber, which is behind the region of the iris, the conjunctiva, the vitreous body, so over here, the oriental blood vessels back here. Then we have the orienta, which is right here, the optical nerve. The three main diseases that I found when I researched were the cataract, which affects the lens. It's the opticity or cloudiness, which leads to blindness in one or both eyes. It usually can do non-surgical treatment, which is like meds, eye drops, glasses. They have surgical treatments, which is the nucleus and cortex removed. The crystalline or something, lens removed. Symptoms can be painless. You could just have like blurry vision, reduced visual acuity, severe dryness. Sometimes if you didn't want to have surgery, there's ways that you could prevent it or kind of reduce it, which would be controlling your blood sugar, weight reduction, and it says smoking cessation, so I don't know if that's like stop smoking or the surgical treatment is I don't even know how to say the word. It's like photomuscular It's PHACOEMULSIFLOATION. So it looks like with cataract, and you can do a lot of things to help reduce it and get it corrected, as well as medications and eye drops. The other one is the diabetic retinopathy, which diabetes a lot of people have, so I'm pretty sure that this is something that happens to a lot of people in the world. Just because diabetes is so widespread, and they say that diabetes is the most frequent cause of blindness in adults in America, in the U.S. So the signs and symptoms: poor night vision, blurred vision, difficulty reading, spots in the visual field, which are known as floaters. People with diabetes 1, type 1, and type 2 can both develop the retinopathy, and the longer someone has diabetes, the more likely they will develop this disease. High blood pressure also increases the risk for diabetic retinopathy, and many people with diabetes will have hypertension as well. That's what they're saying. It can be prevented, so regular eye exams, controlling your blood pressure, keeping it within normal limits, controlling your blood sugar, making sure it don't get too high, don't go too high for so long without being taken care of. And it says if retinopathy has already begun to develop, it can be treated with medication, surgery, or a procedure called photocoagulation. Laser coagulation heals the damaged vessel and decreases pressure in the eye. Medication, surgery, the photocoagulation can treat symptoms of diabetic retinopathy and help prevent future damage. But again, it happens through diabetes, so there's no cure for diabetes. So this disease can keep coming back. But to keep it like controlled, you have to control your blood sugar, control your hypertension, which are lifetime processes when you have both of them diseases. I guess nursing education and treatment would be for people to get their yearly exams to make sure they take their blood pressure medications, their diabetic medications, to make sure they control their pressures, make sure they control their sugars. If they're getting too high and they having a hard time controlling them, then they should follow back up with their physician to see if there's something else they can do with them. That way they don't keep damaging their eyes over and over. The other one is glaucomia. It's a very common eye disease. It's the second leading cause of blindness. There are several types of glaucomia. The most cases of glaucomia are caused by increased pressure inside the eye, and the increased pressure is caused by a slow, gradual buildup of an aqueous humor. Normally, it is continuously the oculus humor is continuously circulated throughout the eye, and then it's through the line, and then through the eye, and then it's drained out of the eye through small openings. But when someone has glaucomia, the aqueous humor is not drained, or it drains really slow, which makes it then accumulate and then increases the pressure, which damages the optic nerve. So it will damage this nerve back here. Oh, sorry. It damages this nerve back here after so long. It's not clear why it happens. Some people are born with a predisposition to the disease. The drainage channels in the eye may be abnormally small, or the optic nerve may be usually sensitive. But there's risk and factors for someone's chances of developing it, and those are everyone over the age of 60 are an increased risk for glaucomia. African Americans, Hispanics, Asians are more likely to develop it than Caucasians. Medical conditions, diabetes, hypertension, hypothyroidism are all risk factors for glaucomia. Eye injuries, eye infections, nearsightedness, and a family history. Chronic use of corticosteroids, medications such as prednisone are used to treat conditions of asthma and arthritis, or also give the person a risk of getting glaucomia. It says that people may have glaucomia, but they don't know for many years, because they may not have any signs and symptoms until there's until a lot of damage has been done. Current recommendations: everyone should get a eye exam a full eye exam, the comprehensive eye exam every 3 to 5 years, and everyone over 60 should get an eye exam every year, a comprehensive eye exam every year. If this is left untreated, it causes permanent damage to the vision and causes the person to be blind. So to treat any of these, you basically have to take care of your eye. You have to get your eye exams. You have to control your blood pressure. You need to control your diabetes. You need to follow up with your doctor and make sure you do whatever they ask you to do. And pretty much if you take care of them, then the likelihood of you getting them won't be as high as not taking care of it and letting your pressure, letting your sugar be high, so high that it starts to damage your eye. And I think I covered everything. And sorry about the words. I get really nervous on videos. And thank you.